So thank you all so much for coming today. Effective health communication and health literacy, understanding the connection is what we're going to be talking about today. My name is Nick Vera. I am the user experience and engagement strategist for the network of the National Library of Medicine, Region 2, based out of Charleston, South Carolina. Let's take a look at our agenda today. We'll start with an introduction to health literacy, in which we'll cover what it is, why it's important, and the epidemiology of health literacy, who is most impacted. Throughout this process, we're going to introduce you to some tools which you can utilize to promote health literacy. Then we'll move on to communication, where we'll discuss the concept of universal precautions for health literacy and some best practices for communication. Next, we'll look at how you can use Medline Plus as a tool for reducing disparities in health literacy. Then we'll discuss Ethnomed, which is an online tool you can use to reduce intercultural barriers to communication. So let's start with the definition of what health literacy is. There are two parts to health literacy: personal health literacy and organizational health literacy. Personal health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Organizational health literacy is the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. So Helen Osborne, a health literacy expert, describes health literacy as a shared responsibility of patients and providers. So for the purpose of today's training, let's really keep that in mind, Osborne's definition as a shared responsibility between the provider and the receiver. A provider can really be anybody who provides information, and a receiver can be anyone who receives it, a patient or a library patron, or someone reading a public health message. So why is addressing health literacy important? The simple answer is that low health literacy leads to poor health outcomes. People with low health literacy are more likely to visit the ER and to have more hospital stays. One study showed that they're not only more likely to visit the ER, they are also more likely to return within a few weeks, 2 weeks to be exact. This makes sense because health literacy impacts one's ability to follow discharge instructions and follow treatment plans. Low health literacy can act as a barrier to effective disease self-management as well. This is especially true for chronic conditions that require complicated self-care regimens, as well as people with limited health literacy are more likely to skip needed tests and underuse preventative health care. So one function of health literacy impacts is the ability to take medicine correctly, which requires numerical skills to figure out dosage and reading skills to read the directions. And this is really widespread. So one systematic review on patient medication errors showed that between 19 and 59% of all medications are taken incorrectly. And if you've ever seen a medicine bottle, it can be very complicated to understand at first. So not surprisingly, low health literacy correlates with a number of adverse health outcomes, worse reported health status, as well as lower quality of life and lower, ultimately, higher rates of mortality. So limited health literacy can affect anyone. However, several factors are strongly associated with limited health literacy. For example, socioeconomic status. The epidemiology on health literacy shows that adults living below the poverty level have higher rates of limited health literacy than adults living above the poverty line. There are many socioeconomic variables that are associated with lower health literacy, such as insurance status. Disability is another factor associated with limited health literacy, in particular, hearing, speech, visual, learning, mental, and emotional disabilities. And when we think about that, about how these disabilities impact communication, it can really start to exacerbate. And things that impact communication have the potential to impact health literacy. The National Adult Literacy Survey shows, also known as NALS, shows that more than half of the individuals with vision, speech, or learning disabilities performed at NALS level 1, which is the lowest level of health literacy. 48% of individuals reporting a mental or emotional condition and 35% of individuals reporting a hearing difficulty also performed at the lowest level. So some disabilities are invisible, which is why communicating clearly and designing communication materials for accessibility is especially important in the resource list. So we've included some links to resources that can help with accessible communication, including a tool for evaluating documents for accessibility and a best practices toolkit from the ADA for effective communication. Older age is another factor associated with limited health literacy. Among older adults, health literacy levels vary by education level and access to financial resources. In fact, education mediates other risks in adults of all ages. So, identifying as a racial or ethnic minority and speaking English as a non primary language are also factors associated with limited health literacy. So, some of the greatest disparities in health literacy occur among racial and ethnic minority groups. And cultural differences and language barriers impact communication and understanding. And also, belief systems and customs also kind of impact response to health information. So, there's a lot of intersectionality going on there. Low education level is another factor associated with limited health literacy, but keep in mind all these health literacy factors are, like I said, intersectional. So it's not all doom and gloom. They all kind of interact with one another and can produce different things. But next, let's move on to communication. Effective communication is a building block for other parts of health literacy of our health literacy definition. So when health information is not successfully communicated by the receiver or provider, it hinders the ability to understand, process, and use the information to make informed decisions about health. So poor communication can lead to negative health outcomes. If a provider has trouble communicating what actions a patient needs to take, what's the likelihood a patient will be able to follow through on that? If patient education materials don't effectively communicate information, how likely is the person reading those materials going to be able to use that information to make an informed decision? And if the patient can't communicate symptoms or concerns to the provider, how can the provider make an accurate diagnosis or really suggest an appropriate treatment plan? Well, health communication occurs both verbally and in writing. Print health information includes things like posters, web pages, home care instructions, discharge instructions, medication labels and instructions, education materials about treatment or testing options, warnings about air quality or storms, and other public health announcements. So, this is really all within our environment at any given time. But an essential part of our shared responsibility for health literacy is communicating clearly so that information is always understood. So we can't guess who has low health literacy. It's kind of well, it is a faceless thing, right? Anybody could have it. One of the hallmarks of health literacy best practices is applying the universal precautions for health literacy to health communications. So the idea here is universal precautions for health literacy is that they share and communicate in a way that everyone can understand. So it kind of builds off of this assumption that everybody deserves to be able to understand it, right? So to do this, we need to be as clear as possible, which is the core of it. We know that everyone is at risk for misunderstanding. According to some measures, only 10% of individuals have the skills needed to use health information that is routinely available to us. So applying universal precautions benefits everyone. Research shows that interventions designed for people with limited health literacy also benefit those with stronger health literacy skills. So when information is clear and is easy to act on, people feel more involved and empowered in their health care and are more likely to follow through on their treatment plans or even enact new behavior changes. The Agency for Healthcare Research and Quality, or AHRQ, puts on a health literacy universal precautions toolkit. So this toolkit provides evidence-based guidance for addressing health literacy, which includes 23 tools that you can use to improve written communication, oral communication, self-management, and other supportive systems. This is really great because it promotes organizational health literacy. So if after this class you want to dive more deeply into improving health literacy, check out the link to that toolkit in the resource list and let us know if you have any questions at the end. So our goal is to communicate as clearly as possible. And on this slide, you'll see the left-hand column here shows that what we can aspire to in order to have clear communication. So you can also think of the left-hand column as the behavior change, meaning we need to implement to order to have clear communication. The right-hand column shows how communication usually works or what we want to avoid. So first, to have clear communication, we want to use plain language. To do this, we want to choose common words that you would use to explain medical information to your friends or your family. And we want to avoid medical terminology or jargon that can be really hard to understand. So, for example, say stomach or belly instead of abdomen, or skin infection, skin infection instead of cellulitis. Um, or eat less salt instead of reduce sodium intake. Use words that create images which people can visualize. For example, runny nose instead of excess mucus. Next, use simple messages and avoid complex ones. Keep your messages concise and to the point. Limit the information you provide to need to know information, not nice to know. Sometimes educators feel compelled to explain more than the receiver actually needs to know because there's a lot of info on the topic. And research shows that few people can remember more than 7 independent items at a time. For those with low literacy skills, that limit may be 3 or 5 items. This means that we need to know, this means that with need to know information, your goal is 3 items, and 5 at the very most. For clear communication, learn to anticipate misunderstanding and confirm understanding when you can. Often we assume that a receiver understands our message simply because they don't speak up, and they might not. The English language infers that this silence means that a person understands. Conversation is like throwing a ball back and forth. We have to make sure that they catch the ball. Later, we'll go over the teach back strategy for confirming understanding in our lesson. And then clarify when there's a misunderstanding. Often we try to create understanding by repeating the same thing, only louder. Clarifying, on the other hand, entails using different language to clear up misunderstandings. Lastly, use objective judgment-free language. It's easy to inadvertently shame folks when we talk about their health behaviors. So a really good example is using the term non-compliant. Instead of saying, so I see here you've been non-compliant, you can say, okay, so I hear you say you haven't been taking your medication a full 30 minutes before you eat. That is objective and includes facts that you learned directly from the patient. So there's no disagreement or feeling of judgment there. And so many words that we don't think of as medical jargon might not be understood by everyone. Here are a few commonly misunderstood words. But in addition to this list, feel free to put in the chat who can tell me other words or sets of words um, for the term cardiologist or any of the terms here. PRN, please feel free to share in the chat. Heart doctor, yeah. ORN every day. Lung doctor, sure. Yeah, these are all great. PRN is needed, for sure. Yeah, these are all great. So sentences written in plain language are easy to understand. So here are some examples of sentences revised for plain language. Your COVID-19 test results were negative could cause some confusion because it isn't negative bad. The plain language version of this sentence is you don't have COVID-19, which is amazing, right? But it can be really hard to understand in the moment. But it's much more straightforward and easier to understand than saying like negative. The version of the second sentence, reduce sodium intake, could be confusing for folks as well. So using plain language, it's simple to say eat less salt instead. And in the third example, take on an empty stomach, which we commonly see on a lot of medications. The literal words are confusing. What does taking something on your stomach really mean? And empty of what? Food or drink? The plain language version is simply don't eat or drink before taking this medication. I know a lot of folks, including in my family, struggle with that one. So what are the plain language principles here? In order to promote health literacy, we need to select, assess, and create print materials that are easy to understand. I'm guessing that some of you select and assess print materials, and others create print materials. Here are some plain language principles you can use in order to make communication clear. So we want to use familiar terms, like, again, not jargon, acronyms, or medical terminology. We want to also chunk the info, not chunk it literally from what we're trying to say, but just kind of shrink it. Chunking info really just means breaking down documents into separate topics. And keep paragraphs short, use descriptive subheading, use more headings and subheadings with less under each heading. Use bullet points to organize information. So I know we've all received documents like that before, but they can be really, really big. So we want to make sure we're chunking them. Organize logically, put your most important material first and organize material in order of importance to the audience. So start by stating your purpose and your bottom line, and then include background information towards the end of whatever you're trying to share. And then write in a conversational voice versus academic or research voice. I know a lot of folks struggle with this one, myself included, but we really want to make sure we're engaging the reader. So one way to do this is to use the active versus the passive voice. Active voice makes it clear who is supposed to do what action and when. It eliminates ambiguity about responsibilities, and not it must be done, but you must do it. Not masks must be worn, but wear a mask. So digital.gov has more comprehensive list of plain language principles using plain language examples. So it's a key component of our shared responsibility for health literacy as well. So thinking back to the earlier definition, this kind of dovetails very nicely with that definition. But if you want to learn more about plain language principles, I suggest taking a look at digital.gov. The link is on that resource list we shared earlier. There are two concepts that people sometimes confuse. So plain language and readability. Readability is how easy something is to read, and readability is measured in terms of grade levels. The NIH recommends that the readability of patient information material be no higher than 6th grade level. And there are readability calculators you can use to see the grade level of a document. These formulas are based mainly on sentence and word length. And however, there are a number of issues with readability formulas, so they aren't really good for making an overall assessment of whether your document clearly communicates info or is easy to understand. So be careful with that. First of all, online readability scores are inconsistent and often inaccurate. And secondly, readability formulas ignore most factors that contribute to ease of reading and comprehension. So just because someone can read something at a certain level doesn't mean they can understand it or know what to do with it. So if you rely on a grade level score, you can be misled into thinking that your communications are clear and effective when they might not actually be. And that's because readability formulas don't take into account the user's context or the principles of plain language. So by contrast, plain language addresses those factors and contributes to ease of reading and comprehension, and ensures that readers can get a better grasp on the message the first time they read it. So the bottom line here, and there's a really good funny comic here, readability, plain language, and health literacy are all important. So it's important to understand what makes each part unique. Now I'm going to talk about a tool you can use to assess written materials for ease of comprehension. There is a link that I believe should be in the chat. And we will go ahead and end the show. This is the suitability, or SAM rather, this suitability assessment of materials, which is an instrument that offers a systematic method to objectively assess health information materials in a short period of time. So SAM scores materials in 6 categories: content literacy, demand, graphics, layout, and topography, learning stimulation and motivation, and cultural appropriateness. Within these categories, SAM lists different factors, and for each factor, SAM has a scoring guide. This takes the subjectivity and guesswork out of assessing written communication materials. And here are some other factors: sentence structure, which we can see down here, and as well as appropriateness. And each factor can be scored as superior, adequate, or not suitable. So SAM lists scoring criteria appropriately. So I want to give you a chance to really apply this, at least part of it, to the next example we'll see here. And let me get back to our screen really quick so we can see. So within the criteria in mind, we're going to share a link in the chat to a printed document about pertussis. And click that link and use that same guide we just covered in the previous link for subheadings and chunking to give the pertussis document a score, or subheadings and chunking for subjects, headings and chunking, and nothing else. And then after that, we'll come back and we'll see how you did, and we'll reveal the answer.
Hey
And we'll
Nick,
take about 4 minutes for that.
if you don't mind, there's actually one question in the chat
Yeah.
that says, could one use AI to apply SAM to a writing?
That's a really good question. I feel like you could. However, AI is still very much one of those tools you kind of have to go back and always kind of check. Now, that doesn't mean it won't always get it right, but at the same time, I think it's a step in the right direction. Say you had a really big, large document or communication you wanted to kind of write up. I think if you were to kind of build a prompt around that, you might be able to kind of get away with it in the terms of just doing a quick spot check, but that is still not a replacement for, a human actually going in and making sure that it kind of follow those guidelines. But I think if you did want to kind of get a quick like temperature gauge as to like adequate, superior, I think it might be a good shot just to see what it spits out. But always, it's funny, I just got back from a conference talking about this for communications. Always try to get it in front of folks that you're actually trying to reach. So if it's patients, see if you can try to get a patient to look at it, or even, somebody close to that who works with folks like that so that they can kind of get a better idea of what it is that you're trying to get them to do. So if it's like a new behavior or less sodium or whatever it might be, just try to get it in front of them, see how it makes them feel, see what works, what doesn't, and take that feedback and maybe kind of rework it based on that. All right. So, this is really what we're going to be describing today. This was the example. And so, why it's superior, so we can see that like really nice chunking of how everything kind of flows. So what is pertussis, right? It has that first thing up at the top, which I guess here would be considered your problem. So what it is that you're actually trying to communicate. And then going a little deeper and using that chunking method, as well as some bullet points on the right with the 3 items under the subheading. Because remember, 3 is always a good number as long as you're under 5, because folks tend to be able to stick with that. And we can see that the color scheme is also really nice here. Everything's bolded, or at least the parts that should be bolded should be, and everything kind of flows in a nice general direction. And ends with your most least important, not least important, but information that maybe isn't as neat to know, right? And so, next thing, kind of leading into what I was getting at with the visuals and the colors, let's talk about that. So, visuals such as pictures, drawings, charts, graphs, and diagrams can be an effective way to convey information because they fill in where words may not be understood. Visuals shouldn't be used in place of text because people can interpret visuals differently. So, just as they do words. So, in different ways, kind of like the word beauty, it means different things to different people, or like a piece of art, it means things to different people, right? How visuals communicate can really enhance text, but also ruin it in some ways. But for the most part, it enhances text and helps reinforce written or oral instructions. So we just want to make sure that we get it right. So concentrate on the meaning. Think about what action you want the person to take. Use images to provide visual cues. And then use clear headings, labels, and captions. These help you to be clear about the purpose of the image. So for instance, the image on the left shows the mother drinking and her baby inside her also drinking. And the caption says, when mother drinks alcohol, baby drinks alcohol. Alcohol crosses the placenta and circulates into the bloodstream of the fetus. That caption makes it clear what the visual is intended to convey. So use simple, realistic pictures as well. Research shows that when illustrating a medical concept, simple line drawings are often most effective. Use color to aid comprehension. So, for example, in the Pacific Northwest this summer, there were warnings about air quality due to forest fires. Those numbers the numbers about PM 2.5 on their own didn't really mean much right in that context, but the public health messaging about air quality was accompanied by green, yellow, orange, red, and purple markers. So those make it easy to understand when it was safe to go outside. So keep in mind that there are variations in the interpretation of standard images. Sometimes these reflect differences in the symbolism that prevails in different cultures. So for example, in some cultures, the image of an owl represents wisdom, and in others, it represents death. So again, make sure you're um, reaching the right community and knowing what those visuals may or may not mean ahead of time. But let's move on to verbal communication. Here are some best practices for clear verbal communication. Listen carefully. Try not to interrupt people when they are talking. Pay attention and be responsive to the issues they raise and questions they ask. Use the receiver's words. Take note of what words a receiver uses to describe their health concerns and use those words in your conversation. Use plain language, not medical language. You might notice some overlap in this list with the print communication. With verbal communication, it's equally important to use plain language and avoid that jargon. And then slow down. If you talk too quickly, it's hard for folks to understand new concepts or formulate questions. Speaking slower increases comprehension for people who might have hearing loss or for whom English is not their primary language. Limit and repeat content. Repetition can really help people remember information and give them more chances to ask questions. For example, you'll notice we're repeating a lot of the information in this webinar that you've already seen, such as use plain language. So just like with print communication, keep things to a need to know basis and not want to know. Remove extraneous information and limit the essential points to exactly what they need to know. And then demonstrate how it's done. Instead of just telling folks about something, include a demonstration where when you can, for example, if you're showing how to cough into your elbow instead of your hand, act it out. That little vampire cough, right into your elbow. It's always a really great way for folks to kind of understand what it is that you're asking them to do. Research shows that people with low health literacy ask fewer questions as well. So when you say to someone, "Do you have any questions?" it's easy for the receiver to say no. This could be because they're either embarrassed, shy, don't really understand, or they don't realize that there are things that they need clarification on. So instead of saying, "Do you have any questions?" invite some questions by asking, "What questions do you have?" This normalizes asking questions and encourages the receiver to think about what they need clarification on, if at all. It's important to confirm understanding as well. However, when you ask, "Do you understand?" it's very easy for someone to just say, "Yeah." Instead, you can use the teach back method to confirm understanding. Um, who here is familiar, if at all, with the teach back method? If you are, drop a thing in the chat and let us know. I'm sure all of you have done it either with students or with faculty or researchers that you've worked with in the past. It's a really great method. And if you don't know it, chances are you have done it. We just didn't call it the teach back method. But for those that don't, the teach back method is a method to ensure that health information is communicated so that the receiver understands it. You start by breaking down the information into small chunks. You teach the first chunk, then you ask the receiver to teach it back to you in their own words. If they understand, you move on to the next chunk of information to do the same thing. If they don't understand any part of it, you can reteach the information using different words or a different practice, right? When you use the teach back method, it really helps to convey it's not a test of understanding on the part of the receiver. It's more or less how you're communicating it. One way of doing this is to say, "Would you mind repeating back the instructions so that I can see if I was clear?" The focus is on if I was clear as the communicator, which is a really great thing to do if you aren't doing that already. So next up, we're going to talk about Medline Plus, and we're going to show you some demos here. But for those that don't know, Medline Plus is an online health information resource from the National Library of Medicine for patients, their families, their friends, and it has a lot of reliable health information that is really easy to understand in both English and Spanish. And the best part is it's ad-free. So once we're on Medline Plus, by the way, welcome to Medline Plus for everybody. I'm sure all of you have used it quite a lot. But this is Medline Plus. It's a free trusted resource for health information, and it's a really good one for folks who just want some quick information that's reliable, easy to understand, and has a summary of just about anything for the most part. But to get started, I really want to show you all some of these chunking things that we kind of see throughout the main web page. So we can kind of see the layout here. It's very well inviting and not overwhelming to us. Not a whole lot of use of color in terms of like over in your face, but more or less subtle. But we can also see some chunking down here into different types of categories, as well as a search bar up here, which is where we're going to go and do our first search. But they've really done a nice job here with kind of the layout. So we're going to go ahead and try heart failure as a search term. And when we get to heart failure, we're going to get a lot of results, but really we can see here that it provides us a quick synopsis of, well, what is heart failure, right? Because if you're looking for heart failure, chances are you want to know, is this me or is this someone I know? Like, what do I do, right? But in Medline Plus, it provides you this really great synopsis of what it is. And if we click right here under Read More, it'll take us to a more specific page with an image of somebody holding their chest, which may or may not be somebody in that situation or what that might look like. But on this little box here, we can see some more really great chunking and use of bullet points. Now, they did go over the 5 limit rule, but we'll go ahead and let them slide this time. But we can see a nice basic summary of it. And if we click it, we can click here and we'll get a little more of a synopsis of what it is, who is most likely to develop heart failure, medical conditions, things of that nature. And also the other fun part is if you were to go back all the way down, it'll also provide you treatments and therapies, living with related issues. And what I really like about this website and what makes it pretty user-friendly is if you're like me and hate scrolling all the way back up, you can click the little triangle right here and it'll take you right back up to the main page. And the other thing I wanted to show you for Medline Plus is that it's a really great tool for folks who may not speak English or English is just not their first language. This isn't the only language they do. They have a lot of different languages that you can select from. So if you're working with a patient or a patron who just, is looking for something on heart failure, for example, I really hope not, you can quickly, try to triage that with the language. But the other fun thing is if you click Espanol for Spanish, it'll quickly convert everything on the web page to Spanish. Same functionality, same usability so that folks can quickly do that. And when you're done with it, you just hit English and it takes you right back. So a really great resource here. And it also does drug supplements and things of that nature, but we do have other trainings for that as well. Let me take you back to our PowerPoint. Okay. So culturally aware communication. So reducing language barriers is important, but to improve health literacy, you also need to address cultural barriers in health communication. Here's some of those tips. So tailor messages to specific groups. Again, thinking about the communities and folks you work with. Who are they? Get to know them, try to understand what they are, who they are, and try to build messages around that. Be aware of cultural norms and customs that influence communication, decision making, and health beliefs and behaviors. And then we want to avoid idioms and jargons, kind of like we've been talking about. American idioms can be especially confusing for folks from different cultures or for whom English is just not their first language. We have a lot of them, so try to avoid them if at all possible. Use high quality translators and interpreters when possible. You really want translators to translate the meaning of a message, not literally translate each word. And finally, the most obvious, we want to avoid stereotypes. We want to make sure the folks we're reaching, we're being inclusive and also that they're getting the information they need. And then utilize visuals and examples that reflect the audience that you're trying to reach and, share information with. If you're using visuals in written communication, you want them to engage folks, not alienate them. So there's this really great example on your screen here we see different folks from different backgrounds, age groups, ethnicities, and parts of the world, and they're represented all in one infographic to show the different ways on how to cover your face and maintain that distance during COVID, right? So really great examples here. And we can also see that chunking and different ways in which to kind of have fun with it and make sure that the information is being communicated properly. And there's a really great resource which we'll dive into in just a second, and it's called Ethnomed. It's probably one of my favorite if you're ever just getting to know folks. But you can use this to improve cross-cultural communication and raise awareness and raise your awareness rather of different cultures. So Ethnomed contains medical and culturally information about immigrant folks as well as refugee groups that may or may not, be easy to recognize. And we will go ahead and share that. So here's the Ethnomed page. It's changed ever so slightly. They do have a new little logo, which is very nice. But on here, you'll kind of get a quick overview as well as some happenings. But where I'd really like your attention is up here. So there's a lot of different cultures and ethnicities represented in this list. And by no means is this an exhaustive list, but it's a way to get started. So we'll go ahead and choose Mexican as the example. And what I really like about Ethnomed is it provides a quick profile. So again, that quick and dirty synopsis of where the geography is, the history and politics, but probably my favorite is greetings and displays of respect, etiquette, and it kind of gives you this breakdown of, different things that you might not normally think about when working with different cultures. Nutrition and food is also a really fun one if you're ever interested. It gives you an idea of cold foods as well as hot foods that they are frequently or prevalent in their diet, as well as some religious background and traditional medical practices, which can be really helpful for folks who are working with different communities and have maybe some more traditional values when it comes to their healthcare and treatment of family. And it also has different topics as well, so you can also look for different things in here for different resources. So definitely check this out, it's free. And so the next one I want to show you is the Indian Health Service. So if you work with Native American populations, I see the CC. The Indian Health Service has some really great tools for you that you can use to promote health literacy within that community. So we'll go ahead and look at that one next. So over here, we'll see different things for providers as well as for healthcare folks. But really where I'd like to take your attention to is for providers. But here's the layout of their website. It's very similar to the ones we've been looking at. Chunking is very nice, presentation is good, easy to use and navigate, but we'll go over here and go to providers and we'll look at some patient education, which I feel is probably the meat of what we want to be doing today. So they have some really great materials, especially for diabetes and other related conditions, as well as health literacy, HIV, and influenza. We'll go ahead and look at the diabetes and other related chronic things. So again, really thinking about what we've been discussing today with the chunking and everything. Quick thing for the community. So May is National Stroke Awareness Month. And then if you scroll down, you can start to see some of the materials that folks have provided on this website that they've found helpful in their own work. And these are all downloadable, and you can kind of peruse them at your own leisure and use them however you see fit. In all, that brings us to the end of our presentation. So to summarize what we've covered, just to kind of reiterate this, health literacy is a shared responsibility, and universal precautions for health literacy ensure that we communicate in ways that everyone can understand. And clear health communication best practices include using plain language, limiting to that need to know information, confirming understanding, and being aware of cultural differences. And then, like we were kind of demoing, there are a lot of free online resources you can use to promote health literacy, including that SAM handout, the Medline Plus website, Ethnomed, the Indian Health Services website, as well as the AHRQ Health Literacy Universal Precautions Toolkit. And we will go ahead and get to those questions.
Let's see. Let me scroll to the first question I saw. So there was one that says, how do you know when to use professional language versus using plain language? And you might have already answered this on the second half of the presentation, but I thought to bring it up anyways.
Yeah, so when to use professional versus what was the other part of that, Sam? Sorry.
The plain language.
Plain language. Well, I think it's a good way to kind of do both, but I think if you're dealing with folks like that are researchers or students, maybe kind of know your audience in that example to really think, what are they asking me? What are they needing to know in this moment? And kind of build off from there. Not necessarily test knowledge, but kind of get that check. I know we're all familiar with that reference interview. Folks oftentimes ask questions that may or may not actually be what they're needing per se. So kind of feeling that out and thinking through what level of communication they might need, whether it be they already know this, I'm going to go ahead and approach it, using common knowledge, jargon, all of those things. I think that's a really great approach, but also using the universal approach of just kind of chunking and using those um, smaller practices, I think would be a really great resource as well to kind of ensure knowledge.
Awesome. Thank you. And there was another question that actually started up a really good discussion in the chat, which was um, when it comes to doing the teach back method, what about people feeling pressured or tested when you try to do the teach back method? So what are your thoughts on that?
I think that's a really good question, and I think sometimes you will get folks that are like that. They feel like they're being tested, and it can be a little condescending, for lack of a better word. But at the same time, the whole point with that method is to kind of take on that onus, right? Take it away from them and just say, like, I'm doing this for really my benefit here because I want to make sure that I'm doing this properly. And I want to make sure that I'm communicating effectively and that you understand exactly what I'm saying because, X, Y, or Z, whatever the topic may be, can be a little challenging and want to make sure that you're getting the message.
Awesome, thank you. And there was a question from Nora about what can NL or excuse me, what can NNLM tell us about the current state of Medline Plus? The last that they communicated was it will no longer be updated unless I missed something, and I'm not sure how long I could safely recommend it as a source.
Really good question. I think from my understanding of that announcement was that it's still being updated with like the core stuff. So you won't see like a disruption with that. But I think some of those more recent things, so like the news, nutrition, not nutrition, but like the recipes and stuff that they were posting on Medline, I think those have gone away since. But as far as I know and have heard, there hasn't been too much of a disruption to the core stuff, and they are still updating like again, like that core stuff. Um,
Thank you.
Sam,
And I also
yeah, go ahead.
added there's a page on Medline Plus that actually goes over their process of like updating it or their like guidelines of updating Medline Plus. So hopefully that will be a helpful resource as well. Let's see. And then we had another question from Nora. Oh, and it's actually to the audience as well. Does anyone know the names of the reputable vetted organizations who provided translation services and assessment of health literacy levels for health information for both patients and or provider? And it's in the Q&A tab if you want to open that up. I could also reread it if it
No, you're
helps.
good.
I know these are a lot of great questions.
That's a really good one, Nora. I can get back to y'all with an email on that after I do some digging. It's one of those things I haven't actually thought of, but there are services that I know that are free, especially for hard of hearing and deaf folks who would utilize those services. But yeah, I wouldn't have that in front of me at the moment, but I can definitely get back to you.
All right, so I'm catching up in the chat. So there's another one about wondering if plain language is a concept for English language, or is this concept applies for different languages as well, for example, Chinese?
Really great question. Very different language. Very. what is it, character based. So I don't see why that wouldn't be or have some kind of relationship to being relatable. Um, but I think that might be a whole different conversation that I am not the person to be asking on that. But I don't see how it would be a harm, if at all, to kind of use that chunking method, but also plain language in general to making sure that you're getting the most out of whatever visual or communication it is you're trying to do. But if you're just talking to folks, I know there's been a lot of challenges with folks trying to translate like word for word, literally, and sometimes they just don't transfer. And I feel as though like Chinese might be one of those languages where different words have different meanings and vice versa, which can really kind of aggravate and have things get lost in translation very quickly. But really great question.
All right, let's see. I had another question. Okay. So, do you have any educational material or information for health literacy, plain language, etc., in Spanish language to use to promote?
I feel like we do, but I would have to find it. I don't think it would necessarily be on Medline, but I believe we might have a health literacy version of an NLM LibGuide that could be on the website. And I can definitely get back to you on that as well, or try to find it really, really quickly. We have time.
Let's see. Seeing, I might have, there's a lot of great conversations happening, so you're welcome to re-enter your question so it gets to the top of the list because I think we covered all the questions.
Yeah, it looks
Let's
like we only have the health literacy guide, which does not provide different languages. Um, but I can go ahead and share that in the chat as well if you'd like.
Oh, okay. So there's a question from Christine, and I believe this is related to Medline Plus, or it might be any type of resource, but is there resources in Amish or Mennonite resources?
Ooh,
Yeah, it's very specific, but it's great.
really good one. Just looking at the website. No, however, I do. These are all great questions, y'all. Y'all came ready today. I love it. Um, there is a really great community center or health center in Pennsylvania. I believe it's Harrisburg or Lancaster that does a lot of great work with Amish communities and is partnered with I want to say the Hershey Medical Center that has a lot of great resources. I actually went and toured a community center a while ago in Harrisburg, and they were kind of talking about that. So lizard brain memory kind of coming into focus here. But I can definitely like look all of this up later and put it in our announcement when we get back to y'all with the recording.
And then there's one about, in your opinion, how does AI complicate health literacy?
Ooh. This is a hot take. I think it complicates literacy in general. So before we even dive into health literacy, I think it kind of undermines a lot of what we're taught with literacy in general. So not only evaluating sources, but beyond that, being critical of the information we provide folks, as well as the information it provides. But I think kind of asking those questions of like, where is it pulling from? How is it getting these resources? Really interrogating what it is that it's trying to share with you and making sure that it's relevant and backing those up with your own kind of critical analysis of those resources, and maybe supplementing that with other ones that you might know. But it both complements, but it also undermines. So yes and no to both. But I do think it has a lot of potential to be helpful for folks who are, always dealing, with different communities that need different materials that you just need a quick, way to churn them out. But really kind of thinking about, um, you know, quality over quantity. So it's not necessarily how fast you can get it out, but you want the quality to always be there. And I think with what health literacy teaches us is that's the biggest centerpiece of it all is that it has to be quality at its core. Everything else is secondary.
Great, thank you. And it looks like a lot of people are adding a lot of great resources in the chat too. Even someone who's in Harrisburg shared some resources as well. So I love that everybody's sharing all the resources that they have and are sharing with one another. Now, I don't see any other questions, but again, I might have missed it because there's a lot of great conversations happening here. So, yeah, and it looks like we have 3 minutes left. So unless there's any last minute questions. I'm going to share the evaluation link in the chat if you want to claim, as Nick mentioned earlier, if you want to claim any MLA-C credit or chess credit, just fill out this evaluation form. And also, we really appreciate any feedback you can provide us as well. Here, let me send that to everybody in the chat. All right, we got some thank yous.
Anytime. I'm happy y'all bared with me, and thank you for your patience with trying to figure out those screens. I really appreciate you.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel or select a video thumbnail to watch another video from the channel.